Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, September 16th, 2024. I'm joined today by Dr. Lisa Kalik, who's going to tell her birth story. Lisa is a terrific physician, and she's also one of my all-time favorite patients. Her birth story is absolutely incredible. As you will hear, it begins as a very difficult and painful story, but then, due to her strength and resolve, becomes one of the most uplifting and wonderful stories you will hear. Thank God she and Jeff and their 2 children are doing great, and it was such a treat for me to see her again in person when we recorded this. I know you will love this story. A few reminders: The Unexpected, which is the book I wrote with Emily Astor, is absolutely available wherever you buy books, so go get one. Second, please do email me any questions you might have for our mailbag podcast. You can email them directly to hw@healthfulwoman.com or go to our website and click on the link that says send us your questions. Reminder, these questions are for mailbag podcasts, not for personal medical advice that you need answered quickly. If you have a question that needs a doctor, please ask your own. All right. Thank you all for listening. Have a terrific week. We'll see you next week. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. Dr. Lisa Kalik, thank you for coming in. Welcome to the podcast. I'm so happy you're here. It's so nice to see you.
Thank you for having me.
So I've been thinking about you for a long time. We were talking just offline before, a lot of people come to our office. You're a doctor, I'm a doctor. You see a lot of patients over the course of your career. And many you remember, some you don't, just because, you don't see them that often, and some really stick out. So for better or worse, you're
or both.
Yeah, you're one of the people who stick out. And we'll go through it, obviously, because your story is so dramatic, but also, thank God, because it ended sort of well. And also the fact that you're going through this as a physician added definitely a layer of, I don't know about complexity, but certainly interest to the whole story that this was happening to a physician you sort of knew what was happening to at the time. So thank you for coming in. I think everyone's going to really appreciate your story. How are you doing right now?
I'm doing great. Everything's good. I have no surprise stories for you. No disasters this time.
Terrific. So I guess we should probably start, just give our listeners a sense sort of, who you are, where you're from, and sort of where you were in life coming in to your pregnancies, I guess in the 2010s.
Yes. So I got married at 35 and I, started to try to get pregnant right away, which by New York City standards is pretty young. But, and I, just was trying to get pregnant. I went off birth control after 18 years plus or whatever. And I was, peeing on a stick, trying to get, I wasn't actually ovulating regularly, but I peed on a stick for like 60 days in a row and I got pregnant, naturally. I thought, this is great. Easy peasy.
Yeah.
I then actually had a very early miscarriage with that pregnancy, just sort of typical, started spotting at 8-9 weeks. And, there was an empty gestational sac and no baby. I had a confirmed heartbeat prior to that. But so that was sort of a typical miscarriage. And I actually remember the OB that I was seeing at the time. She said, "Don't worry, you'll have another baby, no problem."
No problem. Yeah.
And it sticks in my mind because, especially as a physician, you have to be so careful with your words. Because I remembered her saying that, as time went on, and I was like, she was so wrong. She was so wrong. Not that it was her fault. And that miscarriage, the only tough part, I was of course disappointed and sad, and I chose on her advice to not do a D&C after I had the miscarriage. I took misoprostol, medication that helps you remove the remaining pregnancy. And that was really actually a horrible experience for me. I don't know what most people experience, but I just felt terrible on the medication. I was like having chills, stomach pain. Then you start bleeding. It was just not a fun experience. I wouldn't recommend it to anyone. Maybe it's not like that for everyone, but I found the drug really hard to tolerate. So that happened. And then I continued to, there was no reason to think there was anything unusual about that.
Right. Were you at the time you weren't obviously you're disappointed, but you weren't like discouraged about the prospects.
I was really sad, but I thought, okay, like I understand this is probably a chromosomal normal miscarriage. And, this happens. And there's no reason to think that there's not.
Right. And do you think that being a physician, and because, most people who take care of are not doctors, but a certain percentage are, as you know from taking care of doctors, it can go in two ways. Some of the doctors take care of are very like, yeah, this is fine. I'm good. I get it. Like all's good. And they're like the easiest patients. And others, the exact opposite, because they can do the deep dive into like, oh no, I did a deep research onto this and there's something horribly wrong with me. And, everything is terrible. And why isn't this? So you're sound to be more like the former.
I was, I was very sad. Compared to what happened after the fact, it was like small potatoes. But no, so I don't want to downplay it. I was really sad and disappointed, but I wasn't worried that I wasn't going to have a baby.
Right.
In the long run. So over the next several months, I didn't get pregnant. And then I think, 6 or 7 months went by and then I was 36 and I was like, wait, let me just, make sure. Because I wasn't ovulating regularly. So I was getting nervous that I should get it checked out. So I went to a reproductive endocrinologist, got a workup, sort of unexplained infertility. And he just recommended doing Clomid and, timed intercourse, see what happens. And I actually got pregnant, the first month doing that. And I had a confirmed heartbeat. And then that ended in a miscarriage very early as well, like 6 or 7, I think 6 weeks even. And I opted to do a DNC, which was so much better than the medication, even though it was anesthesia and the whole thing. It was actually my first time having anesthesia. So that was the scariest part. But the procedure itself was very smooth and, I was disappointed again, but the pathology on that fetus or that embryo was a trisomy 18. So again, that is not uncommon at 36, 37 to have a chromosomal abnormality. So there was still no real reason to think I couldn't have a child. So the REI at that point said, let's do some IUIs, which I did. They were unsuccessful. I actually can't remember how many I tried. I think 3 or 4 over, a few month period. It just, they don't always work. Yeah. So he said, let's go on to IVF. I can control the situation. It'll probably work out fine. So I did a retrieval and I actually got 6 healthy, normal embryos. So it was very exciting. We did a transfer and I got pregnant. So then I was like, everything was perfect. I was so happy. And I knew that I had a normal embryo growing, and I came here actually. I came to
what was it that brought you to our practice?
So Dr. Silverstein was my clerkship director in my OBGYN rotation.
You know what? I remember I had forgotten that, but now I remember that. Yeah. That's right, from NYU back in the day.
Yeah. So
he was I assume he was the best clerkship director ever. He's awesome.
And I did deliver a baby with him actually. Like one of the couple babies I delivered during med school, he was, helped me catch the baby. So I was like, well, if he taught me how to do it, it's gotta be pretty good. So actually at my first appointment, he looked at my grades and that's like his shtick to do with his former students.
Yeah, he keeps everything. He has data from his whole life. Ever since computers were invented, he started keeping data.
Yeah, he literally read it back to me. The good news was I had done well. So,
and just for our listeners, what kind of physician are you?
Oh, I'm an internal medicine physician. Yeah, so I treat adult patients in primary care. So everything in the beginning of the pregnancy went smoothly. We did the regular genetic, like the NIPT, had the blood test to make sure the chromosomes were correct, and everything looked good. My nuchal scan looked good. I felt good. I actually love being pregnant. This is not to dismiss people. I know a lot of people don't feel good during pregnancy. I felt fine. I was, I thought it was so cool that I was pregnant. I was really happy and feeling well. And then at 19 weeks, one night, I think it was exactly 19 weeks, I was getting ready for bed and I looked at my legs and they were so swollen. And I was like, this is not normal. And I think this being a physician helped me because I think a lot of women hear about swollen legs during pregnancy and they're like, oh, my legs are swollen, like this just happens. But it doesn't usually happen that early, not typically. And this was really significant, the swelling. And it was like at 9 o'clock at night when I saw this. I'm like, well, I feel okay. Let me just go to bed and see how it is in the morning. And I woke up and my legs were still really swollen. So my first thought being, apparent at this point, knowledge is good and bad because not even close to having OB knowledge, but I have some. So I need to get my blood pressure checked because I was just worried that this was a sign of high blood pressure. So I went to my office, which at that time was in Midtown, and I had one of my colleagues check my blood pressure. At this point, I'm also in a panic about it, and my blood pressure was like 180 over 90 or something horrible. So she rechecked it. I think it came down a little bit, but I was like, this is, not okay. So I, of course, called you guys. I was 19 weeks. So the first thought was like, well, this is not preeclampsia. This is, probably just high blood pressure. We see a cardiologist, which I happened to be in an office that had a cardiologist. So that day I saw the cardiologist. They checked me out. Everything looked good. They did EKG, the whole workup. They spoke to Dr. Bender that day was available.
Yeah.
And they did send all the preeclampsia labs, which were normal. He saw me that day and scanned the baby. Baby looked fine. And so I was put on blood pressure medication. The assumption, since I was, pre-20 weeks, that this was gestational hypertension, which is a little bit uncommon to be that severe, I think, but it happens.
Right. So just for our listeners, preeclampsia is a condition of pregnancy, but traditionally it would not happen under 20 weeks. It's usually 20 weeks. Now that's obviously just, not a random number, but it's sort of a line in the sand that doesn't make sense. So at 19 weeks, it's really borderline. Is this a pregnancy-related phenomenon like preeclampsia, or is this just unmasking something that existed before pregnancy, like chronic hypertension, which you would probably know if you had, which is why it was so confusing. It's like, well, we would know she had chronic hypertension. Like she's she's a doctor, she sees doctors.
Yeah.
But on the other hand, it's so odd to get preeclampsia this early. And it's like a really, if you were 24 weeks, everyone would say it's preeclampsia. And if you're 8 weeks, everyone would say it's chronic hypertension. Right. But at 19, it's sort of like, tough call in that sense.
Yeah. So at that point, we were just monitoring me. And I did go on blood pressure medicine. I went on labetalol. And I think the leg swelling did get better. I don't really remember that. I think I blocked that part out. I don't know. And we were just watching me. And I came in for my anatomy scan. I actually was doing it I think it was just a scheduling thing. I was 21 weeks or 20 weeks and 5 days or something. I came in for my anatomy scan, which looked good. They did, I forget who, I think he's retired now, but he came in and said, everything looks good. Baby's on the smaller side, but looks fine. And then actually I came up to see you that day. You were for my appointment.
Mm-hmm.
And you checked my blood pressure and it was okay. It was 130 over 80, which, is fine in pregnancy. And I mentioned to you that I'd called the triage nurse a few days prior because I'd had some right rib pain. I don't know, you probably don't remember this. And she said, it's probably just, I don't know, the baby moving around or something. But it was, looking back, it was pretty bad pain. I really was having, right upper abdomen pain that woke me up from sleep, that kind of thing. And it had gone away. But I remember when I said that to you, you had that doctor look. So I've had that look too.
Yeah.
Kind of like that flash, like, that doesn't sound good, but I'm not going to panic her.
Right.
And he said, well, we should do blood work. I said, okay. He's like, let's just make sure it wasn't, anything serious. Because I don't know, for preeclampsia, it can affect the liver and cause right upper abdominal pain. So when it was the end of the day and the lab had already closed. So I didn't do blood work that day. But being a doctor, I could do blood work in my office the next day, which is what I did at the end of the following day. So this is then the next morning. So this is 2 days after I saw you, that one of the nurse practitioners in my office texted me or called me actually. And she said, are you feeling okay? Because she's like, your blood work came back and your platelets are like 77, which is very abnormal for people who don't know that.
Mm-hmm.
And I said, okay. I'm like, don't worry. I'm going to call my doctor. And because the blood work didn't go to you, I had ordered it myself essentially with your order. So I called you guys and the nurse got on the line and I said, I need to speak to someone right away. I said, I think I have preeclampsia. And I said, my labs are really abnormal. She said, well, you're pregnant. Labs are sometimes different. And I did pull the doctor card. I was like, no. I'm like,
listen here.
I am a doctor. Like, these are very, and I'd gotten the whole set of labs. My liver tests were abnormal. I knew I was really sick. So I said, I'll send them to you right now. I was like, with someone, I need to speak to someone like as soon as possible. So meanwhile, I'm at work, about to start seeing patients. So I'm trying to figure all that out because I knew that I was in trouble. And I'm also at this point really upset because I know the one thing from your OB training or from med school is the only way to treat preeclampsia is to deliver the baby.
Yeah.
And at this point, I'm 21 weeks. So I'm, devastated because I know what's coming. And so I'm like, trying to figure out what to do with my patients. Luckily, I had a nurse practitioner who was there, could take over. And like, I'm waiting for you guys to call me. I'm, tears are streaming down my face. I actually think I finished a pre-op. Like I was trying to manage my regular life and deal with this. And you and Michael Silverstein got on the phone with me and you said, you have to come in right now. Like, don't eat anything. You're really sick. I mean, you said that. You said you're very sick. And I really actually appreciate that, because I think doctors need to be straight when something is serious. And that's kind of how I practice also. Because if you have to tell the truth. If it's serious, it's serious.
Yeah.
And you can say it kindly, but you have to be,
Yeah. And everyone was, I'm peppy positive. So if I'm telling you you're really sick, you're really sick.
And I was like, okay.
Yeah.
I'm like, this is happening. So, and this is kind of a silly, crazy part of the story. It was rush hour in New York City at that time. And so I, with my preeclampsia and finishing my pre-op and all that, I'm like, I think I should take the subway. It's going to take too long in a cab. Yeah. So I'm like, pre-eclamptic and who knows what's happening in my body. And I get on the subway.
Yeah, it's a motley crew on those subway cars. They got everything.
To go uptown. I'm like, why not? And also...
By the way, it's probably the fastest.
Yeah, it was. Yeah. I'm like, this is the fastest way. But who knows? I mean, I could have gotten, had a seizure on the train. Who knows? And I'm, calling my mom as I'm going to the subway. My husband, who was working the restaurant business at the time, was sleeping with his phone off because he had worked late the night before. So I left him, 42,000 messages and text messages that he didn't hear as I'm trying to get up to the hospital. And and I arrived there. So I'm by myself in the L&D triage and seeing all these like happy, healthy, pregnant women. And I know I'm about to probably end this pregnancy. And I finally did get in touch with my husband. I think I called his friend. I don't know, he was on his way. And I called one of my best friends from med school who's an OB. And I told her what was happening. And she just said, I'm so sorry. And then I really, that confirmed it. Yeah. Because I just knew there was nothing. Like, there's nothing to be done to save the pregnancy. And now it was just about saving me. Yeah. So Dr. Silverstein met me there because they were waiting for a room and the whole thing. And he just came out there and he, in his very kind way, he just took my hand and he was like, and he said, I'm sorry. But I knew that I was in good hands. And I have to say, all my care was, even though terrible things were happening, I felt so, supported and cared for at the hospital and this group and everything. So it was a long couple of days because I opted at the time to do a D&E procedure, dilatation evacuation, to take the baby out. And so that was a process because I had to have my cervix dilated. And I was also pretty sick at that point with preeclampsia. And I was and actually, technically I had HELLP syndrome, right? Because I had
everything.
Low platelets, liver enzyme elevation. And I was put on a magnesium drip, which is a really hard drug to be on. Yep. Very important to protect you from having seizures and and in the case where the baby is viable, it helps to protect the baby as well. Right. But that drug makes you feel like you are on fire. Yeah. It's the only way I can describe it. Yeah. Your whole body feels like it's on fire. So, that took 24 hours, I guess, to dilate the cervix and all of that to prepare for the procedure. And I just felt physically horrible at that. I don't know if it was the drug or the preeclampsia or the combination by the next day. Yeah. But I was relieved at that moment. I was relieved to, be ending the pregnancy because I just felt so physically bad. Yeah. I was so scared. Yeah. And had you not ended the pregnancy, I mean, it only gets worse. Yeah. Yeah. This is life-threatening type of stuff. Exactly. Which is, again, it happens, but it's extremely rare. Yeah, it's extremely rare, but it's pretty awful. Yeah. So I remember being wheeled up to the OR and it was Dr. Melka and I think maybe Dr. Ben, I can't remember. And I looked at Dr. Melka and I was like, please fix this. Cause I just felt so sick. I remember saying that to her. And I was relieved to go under anesthesia because I just didn't want to be awake for this anymore. Mm-hmm. And I remember waking up and at that moment, I felt that I just could tell that the pregnancy was not in me anymore. It was almost like, I don't know, I can't describe it, but it was like I knew whatever was, trying to kill me was not there anymore. And then, of course, I was, in the days, weeks following, I was devastated. I mean, I was just so sad. And because it's a weird kind of loss because there was never a live baby in my hands, but it was the hope of that baby. And, everybody knew I was pregnant, and it was, it's different than an early miscarriage when people don't know, but everybody knew. So including patients, oh, how's your baby? And it was just like,
right.
So I came up, with the quick party line to like kind of, change the subject with patients and people that I didn't want to talk about it with. But it was really hard. I was really sad. And I still have sadness about that pregnancy and others. Not, it doesn't, in the beginning, it was about that baby. And I think over time, and I'll go into what's happened since then, but it was more also just the loss of being able to like carry that pregnancy. That in itself creates a lot of sadness and grief for me. But I was alive and I was healthy and, my blood pressure came back to normal.
Yeah. Did you tell people what happened? Like, let's say your circle, like your friends, and that you were sick and, the whole thing.
Yes. Yeah. I mean, depending on the person, how much detail I went into. I mean, I really, like I had an abortion. I mean, that's what I had, which I also think about in the current, not to get too political, but like if I had lived in another state and it had been 2024, it might have been even more difficult, logistically to have done what I had done. So, so I told people, and at work, I was, more vague about what had happened other than, I lost the pregnancy. Yeah, so I did, people knew, but, the thing is when something like this happens, it's also like when, people have any death in the family, in the beginning, people are very, talking about it and, supportive. And of course, my close family was supportive for a lot longer, and my husband still is. But over time, people kind of forget that it happened, but it's still like very, prominent in your mind months, years later. So that part of it's hard. And also, one of the reasons that I wanted to do the podcast with you is because I think that this type of experience, as much support as you have from a partner and family and friends, it still is something that happened to your body, and that can feel really, really, really lonely and isolating. And so I want other women who have gone through this to know that I think a lot of people feel that way. And actually, we're not alone because there's other people that have gone through this. Yeah. So I think that's important to know.
Absolutely.
So anyway, I had to work up through you guys. There was no reason no identifiable reason why this happened at such an early stage. And I saw a cardiologist and, we did all this stuff and everything, no reason to think I couldn't try again.
Right. You're perfectly healthy, when you're not pregnant. Right. Yeah.
So I did the first, I had a failed transfer. I had a subsequent pregnancy that didn't go to preeclampsia, but there was a problem with that fetus. And, long story short, it was not a viable pregnancy, but it went on the pregnancy didn't end until like 17 weeks. Yeah. That pregnancy. So that was also.
Right. And a totally separate thing.
I think.
Totally separate. Crazy.
Yeah, another crazy thing. Yeah. So, and it was a normal embryo, but, the testing of embryos isn't perfect. Yeah. Who knows? So, at this point, a lot of time had gone, this was like, a year and a half. So, anyway, then everyone said, don't worry, you can try again. I said, okay. Came back for more. So, then I had a successful transfer and everything was going along fine. I did an amnio with that just to make sure when you did I think I did the amnio at 17-ish weeks or 18. And I'd been checking my blood pressure regularly throughout that pregnancy. But at 18 and a half weeks, I got like a little cold or something. And I didn't check my blood pressure for a few days because I don't know, I just didn't. And then the weekend came, I was 19 weeks and 2 days, I remember. I was like, I should probably check my blood pressure. And I did. And it was like 160 over 90 or something. So I called. You were on call, actually. I spoke to you. And I said, and I told you what was happening. And I said, should I start blood pressure medication? And you were like, no, you need to come to the hospital. And I was like, oh, okay. He's like, this could be preeclampsia again. And I kind of knew, but I was still, sort of surprised.
That I remember. Yeah. I remember the second time because I was like,
you were very involved.
I was like, I cannot believe this is happening again to this poor woman. I was like, it's it's not that I can't believe it because it's happening, but it's just, I remember that. sadly.
So I went in and I was in the hospital for a few days because I think you and the team were like, let's see how this progresses. Maybe it is just hypertension because of the history and everything. And my blood work looked okay for the first couple of days. But it became clear after, 72 hours or so in the hospital that my liver enzymes started to try. Like it was.
Yeah. I mean, on day one, I mean, you're not going to throw in the towel just because your blood pressure goes up because you, who knows, maybe obviously everyone knows in the back of our minds this could be the exact same story happening again, but you definitely want to see that before you do anything drastic.
Right. And I remember talking to you about it and I remember saying to you that I'm not going to have a D&E. I said, if I need to end the pregnancy, I'm going to deliver this baby. And you were like, okay, no problem. Like I can give you an epidural. We can keep it in for a week. Yeah. And I remember that again, I really appreciated like you were very open to what I wanted. And you were very honest. I mean, all of you were very honest and straight about what was happening. And I think that's so important in this kind of situation. Because as a doctor, I knew a lot and I knew what was happening. But I think for someone who's not, it's hard to like wrap your head around that you have to end a pregnancy. And how are you going to end a pregnancy? And what's the best way, for you to do that? So, but I couldn't bear the thought of, having an abortion type procedure again for a pregnancy that I wanted so much. So anyway, I was monitored for a few days. It was progressing. It was clear that this was, progressing into preeclampsia. And at that point I was, 19 and a half weeks or something. There was no chance of viability. So we decided we did an epidural and I was essentially induced the way anyone is induced for labor. I mean, with Pitocin and the whole thing. And that took, it didn't actually take, I think I got it, I think it was less than 24 hours.
Yeah, all these options are obviously horrible, but if you're at that point, you're 20 weeks-ish and you have to end a pregnancy, you can either do a procedure in the operating room or you can induce. The operating room procedure itself is 20 minutes. But to get to the operating room, like you said, you need at least a day, sometimes two. Yeah. If you induce the labor, the process is usually 12 hours. Yeah. It could be shorter, it could be longer, but sort of from the moment you decide till it being done is actually faster with an induction, even though it takes much longer than the operation. It's sort of like a backwards thinking about it. Yeah.
And I really wanted to see this baby. Sure. I mean, not to be graphic, but the D&E procedures, like, the babies do not come out whole. Yeah. And I wanted to at least see one of my babies. And so we did that. And it was actually, that aspect of it was not really hard. I mean, it was kind of, in a weird way, I was like, oh, I'm going through labor. Like, this, it was sort of weird. Like, I mean, I kept having to remind myself, like, you are not going to have a baby at the end of this. But at the same time, I was like, oh, I'm like going through a procedure that would be to have a baby. But it wasn't difficult physically. So when I ultimately delivered the baby, and I actually called my same, friend from med school. I was like, what should I expect? Because I wanted to know what to expect when this baby came out of me. And I was like, what is the baby going to look like? I had never seen a 20-week, birth. And she said, may or may not make any sound, may not be alive by the time the baby is born, and it'll be really small, big head, red skin, all that. So I was like mentally prepared for visually what I would see. So I delivered the baby. The baby was not, it was not alive by the time of the delivery, and which I think was probably easier for me, to be honest. Then I remember you were in the room, and then the placenta came out, and you were like, I think that's the placenta, because I don't think my placenta looked so good, which makes sense. Yeah, with preeclampsia. I did hold that baby. Her name was Cassie. We named her. It was like I was just hysterical holding this baby, because it was like I saw this little tiny, I mean, hardly a baby, but a baby, and everything looked perfect. I remember seeing her. I just remember like touching her chest and like seeing her, because she was so, there wasn't a lot of fat at that point, and so I could feel like her little, her ribs, and I was like, this is a perfect baby that I felt like my body had just, destroyed. And so that was really painful for me. But I was still glad that I had that experience to like see the baby and hold the baby. Yeah. And
did you take pictures?
The hospital did, and I have them. Yeah. I haven't looked at them in a long time. I almost looked at them today before I came here, but I was like, I don't think I can do that.
Yeah, the hospital tends to tape, and they'll hold on to them, because people sometimes years and years later say, really, I want to see them.
They asked me, they said, do you want them? And I said, yes. Yeah. And they put everything in like a little thing with
like a box.
footprints and the whole. And I have it in my at my bedside night table actually.
Mm-hmm.
And my husband was there. I remember he didn't want to hold the baby. I think it was scary for him. I mean, look, a 20-week baby, it's not like a cute, cuddly baby. It's scary. So, but he was there with me. And I mean, he's amazing. And he's not medical. And so he was like, what is happening? And I really knew what was happening, which was, I think, helpful in some ways. And I knew that pregnancy for me was over. And that was also really painful because I knew that no one in their right mind would put an embryo in me. And I wouldn't want to do it either because I want to be alive. Yeah. And pregnancy just kept trying to,
Did you know that right away?
Yeah. Oh, yeah.
Like probably from the moment the decision was made.
I knew. Yeah. I knew I was done.
Yeah.
And I remember I think it was you that came to the room like the next day. And I'm like, I want an IUD. I'm like, I want one now. I can't get pregnant again. Even by accident. And I've thought about that since. I still theoretically could get pregnant. And I would not continue a pregnancy. It's just not safe for me for whatever reason. My placentas. Yeah. I mean, I know not everything is understood about preeclampsia, but I think the general understanding is that it's a bad, unhealthy placenta. Yeah. And for whatever reason, that's what my body makes. So, so I knew that I would no longer be pregnant or could no longer get pregnant. And so we had to decide what we wanted to do at that point. Yeah.
How hard was that decision at that time? About what to do?
What to do next? I get this from my mom. I'm like a fixer. I'm like, okay, I can't carry a pregnancy, but I want a baby. So
classic doctor.
Yeah.
Problem solver.
Yeah. I'm like, how can I? And I said, I guess. And Jeff and my husband is Jeff, had talked. I mean, I don't even know if adoption had come up at that point, but I immediately thought of, I don't know if we talked about it. I'm like, I'll get a surrogate, a gestational carrier. And literally, I think the next day I was like on the phone trying to figure this out. I think it was part of my grief process. I was like, I need to take action because I want to be a mom. Yeah. And, I'm just going to we met.
That's not uncommon, by the way. I mean, obviously, I know people have had babies through carriers, and I've interviewed people who've had babies through carriers, and that's a very common thing that if it's due to something dramatic, like someone had a hysterectomy at one of their births, or, frequently they're like, the next day I am like deep into this already, doing a deep dive into carriers and where are they? What do I do? Who do I talk to? And it's therapeutic in a sense because there's like this hole in you, and it's the only way you could start filling it in a sense.
And also it gives you a sense of control. Because the thing with these types of scenarios, you have no control. It's nothing that you did wrong. It's nothing you could have done to prevent it. Yeah. And so you have to gain back some of your control by making phone calls. Yeah. Figure out what the next step is.
Like, I can't meet now because I'm on magnesium in the hospital, but next week.
Exactly. And I had embryos left. Yeah. Still. I ended up having to make more embryos later on. Right. But so Jeff and I really wanted to have a biological baby. Right. I mean, we just did. Right. And we had embryos.
Right. So there wasn't like a mental shift you had to go through. It was pretty quick. Some people, because again, obviously people grapple because of it's unusual, obviously, but so some people have just sort of that hurdle to get over.
Yeah. I mean, I had a lot of feelings about it throughout and during and still, but none of those feelings were strong enough to prevent me from moving forward. Sure. And also I knew, time was ticking. We're getting older. Mm-hmm. Jeff's a few years older than me. And I just, it'd already been so many years to get to this point.
Right. I mean, what is from the point you first started getting pregnant until now, how much time has elapsed?
Let's see.
Years.
Yeah. 3 or 4 years.
Yeah. Yeah. 3 or 4 years. And you were saying before, your body's been pregnant how many weeks?
Yeah, I had 60 weeks of pregnancy, 60, all these pregnancies.
Yeah.
And no baby.
Yeah, it's a lot.
Yeah, it was a lot. Yeah, so we started that process and we found an agency quickly that was recommended by my REI. At the time in New York, gestational carriers weren't legal.
Right, you had to go out of state.
You had to go out of state. Now they are. I don't know how that's changed. I don't know if you're seeing any patients yet.
Some, we are.
So we had an agency out of New Jersey, and there's a whole process for matching with a gestational carrier, which takes time. Our first carrier, it was actually at first we thought it was great because she was an experienced carrier, meaning she had her own pregnancies as well as been a gestational carrier a couple of times. So like, this is great. What can go wrong? Well, 3 transfers in, she still wasn't pregnant. We're running out of embryos. So we actually had to, sort of end our contract with her.
Yeah. That must suck for the carrier too, because they want to do this, It
was hard.
Yeah.
And she was not medical. And even though she'd been through this, she was like, oh, let's do another transfer.
Yeah.
And all the doctors involved were like, we don't know why.
Yeah.
Your embryos are healthy. Everything looks good on paper and blood work, but she's not getting pregnant.
Right.
And,
switch.
I have to make a change. So that's another, another year has gone by with all of that. So we were back on the list with on the waiting period with the agency. And, my best childhood friend, even when we started this, had sort of, I thought, jokingly said, I'll do this for you. She and her wife had 2 children. She had carried one of them and gotten pregnant through IVF with a sperm donor. I never really thought she was serious. And that seemed like a lot of emotional complication to have a really good friend do it. I'd always thought, let's keep this more separate. But, Jeff and I talked about it, and I was like, maybe she really meant it. And let me talk to her about this. And so I called her and I was like, how you said you wouldn't mind carrying my baby? Did you really mean that? And she was like, yeah. She's like, I really. So then we actually had a real conversation with me and my husband and her wife, and we talked about it. And
it's a pretty good friend.
Yeah. Oh, I mean, yeah. There's nothing I can do to thank her. And so we had a conversation and we talked about it, and she was like, "No, I can do this for you." And I mean, it's just such a gift. And so we did bring her into the agency, so to speak, because I wanted to make sure.
Do it official.
Yeah, we made it official. There was a contract. Because it's still, it's a big deal to carry someone else's baby. It's not like, picking up, something at the store for them.
Yeah.
So that took some time, but it was a lot faster than waiting for a regular person through the agency. And so we did all that. First transfer with her didn't work. And we were down to 2 embryos. I'd done 2 more retrievals throughout this process. So in the whole thing, I made a total of 10 embryos, and now we're down to 2. Second transfer worked with her though. And she had, picture perfect pregnancy.
For the pregnancy, did you go to all the visits? How did you do that? Because everyone does it differently.
So she lives outside of Boston, and we went to the anatomy scan. But this is someone that we talked all the, this is someone I talked to regularly. And so that was the only visit we went to, just because it was, she had 2 kids, it was just complicated scheduling wise. But she was great, and she, knows how neurotic I am, and I'm a doctor. So that made it very easy, because she was she would tell me what happened right after the appointments. The OB was willing to speak with me if I had questions. And luckily it was a very, I kept waiting for the disasters, but she's good at being pregnant.
Right. She's like, what will go on? What did her kids, how did that dynamic work?
So interesting, she didn't tell her kids till she was about 20 weeks pregnant, because she waited a long time. And because they have sort of a non-traditional way, they used a sperm donor and all this, her kids at the time were, I think they were 8 and 6 or 9, something like that. Or no, 8 and 7, her kids are 16 months apart.
Yeah.
So they already understood the concept of sperm and egg and how an embryo. And so they knew they had that language. So she just told them that.
Yeah.
I needed that, Lisa needed a uterus. And that's what I'm doing. So so they thought it was really cool and special.
Yeah.
And the good, I think, was really, and it was a little bit different with, subsequent care that we used, but with my friend, because she knew me and because she was doing this for me very specifically, she had, could stay very separate emotionally from the meaning. There was I think it was a little bit harder for my other carrier with my daughter. It was she knew that this was my, so there's no, it was really easy for her in that sense. I remember when she delivered the baby the next day, she's like, okay, I'm going home. See ya.
Yeah.
See you in a week for the baby name. But it was, she had a very healthy pregnancy, and we did decide to induce her just so that Jeff and I could, plan it and be there and everything. The induction went fine, and we were all there when my son came out.
Wow. What was that like?
It's really crazy. First of all, to have a live baby that is your baby.
Right.
For me, after having all these non-live babies, that part of it was amazing. But the baby came out, and he looks more like me now. But in that moment, he looked looked really like my husband. And we all, put the baby on her belly. We all, everyone put the hands on it. So we got lots of, immediate touch from everyone. I actually didn't do lactation, which is a whole other part of the story. But I just I was wearing a hoodie with, just skin underneath. And I just took him in. I just tear my husband. It was just so emotional to see this baby that was ours after the whole, at that point he was born in 2019. So
over 5 years.
Yeah, over 5 years. So no, 7, I think it'd been we got married in 2012. So it'd been 6 or 7 years.
Yeah.
Was there so much loss and disappointment. And here was this baby in our arms. And I was relieved. And I was relieved that my friend was okay. Cause it's also, especially because it was a friend, I didn't want anything bad to happen to this generous person because to me, pregnancy is so dangerous.
Yeah.
I don't know how anyone has a baby without dying and all these things. So that was always on my mind. So I was glad when, she was safe and healthy and here was this baby that we got to bring home with us.
That's crazy. I also remember vividly when we all found out that you had a baby.
Yeah, I texted all of you guys.
And it was just oh, thank God. Because, it's these things weigh on you, this poor woman, what she's been through and we couldn't help her. There's nothing we can do for her. And it's she's out there in the world, in misery.
Yeah.
And it's it's very hard to know that. Yeah. And then it was thank God you made us feel a lot better. We're oh my God, finally. Thank God for this family. They have some happiness. And it was it was just awesome. Yeah. It was so cool.
Yeah. It was and it was, I think anyone who knew us and knew this story was just everyone was so happy because it seemed like such a magical miracle that we had this healthy baby. And and in the meantime, while this was going on, we were still working with the agency.
Right.
And we had actually matched with another carrier for a second journey. So when my son was, I think he was 9 or 10 days old, we transferred another embryo to this woman, this very kind woman who was living in Washington, D.C. And it was our last embryo. I had a 10-day-old baby. I couldn't even go to the transfer because I just had a 10-day-old baby.
Right.
And she got pregnant.
Wow.
Yeah. My son was born in May of 2019. And my daughter was born in January of 2020.
Right. So you, by surrogate, were pregnant for 17 consecutive months.
Yes.
Basically.
Yeah. Essentially. Yeah. Yeah. Yeah.
Wow.
So, and my daughter was born in January of 20, and 6 weeks later, COVID happened. So we had these two babies under one.
How far apart are your kids?
They're 8 months and 3 weeks.
That's unbelievable.
Yeah. Which is hard. So it's that time that because they're so close together confuses a lot of people.
Right.
Because it's it's hard to get into this whole story with random people that you're meeting. Yeah. It's a lot.
So they're a year apart.
Yeah, I just say they're a year apart. For the people that know me well, I get into it. But otherwise, they're a year apart. It's just too much.
I was just talking to Erin Golly before because I said you were coming in and she's like, didn't we have someone? I was like, yes, we had someone who had a carrier who was pregnant and then she got pregnant. They were doing for infertility. And so she has kids who are 3 months apart.
Yeah,
people are what? It happens.
Yeah, I've heard stories like that. Yeah.
Yeah. And they're siblings, right? Because it's, they're genetically siblings and they're just born 3 months apart. Yeah. Okay. Whatever.
Yeah. So, but it's actually nice because they really, especially now they're age 4 and 5 and they're friends. They also, fight with each other, but
sure.
But they love each other. And I'm so glad that my son has a sibling. It was, the pregnancy with that carrier went basically, there were some questions that came up on an anatomy scan.
Right.
But it was stressful because she had to get an MRI, but it all, worked out.
Right. Overall, though, since you had just been through the process, I imagine there was probably a little bit of relief.
Yes.
In the second time around.
Yeah. There was. And
you're also busy with a newborn. Right. You don't have time to think about these things as much.
Yeah. And I was much more separate from that pregnancy because it wasn't a friend. It was, more, I mean, it was more, not that I don't want to say business, but it was more, it was more of a,
you didn't have a relationship with this person prior.
Right. And we do keep in touch. Yeah. Well, I keep in touch with her, not all the time, but we send pictures.
I think that's pretty common.
It was a lot. It was when I left the hospital with my daughter, it was a lot harder for her than for my friend. Because I think with my friend,
was that her first time being a carrier?
It was her first time being a carrier.
Yeah, that makes sense.
And, she was postpartum. And I said, do you want to hold the baby? And she said, no. And I said, okay. I asked the social worker to check on her. I'm like, just make sure she's okay. She seems really emotional. And, but I think for her, she knew that, we would keep in touch, but we don't have a relationship. So like her connection to this baby that she'd been carrying was ending. And I think that was hard for her.
Right.
A little bit in that moment.
Do your kids know?
So good question. We recently told them. It was never a secret.
But when do you tell them? When they're 2? Like, what's the difference, you know?
So, but I was starting to feel like maybe they were going to hear something from someone else. And I wanted to explain it to them. And I didn't want them to think it was a big deal or that it was like abnormal, even though it's unusual. I wanted it to just be, woven into the fabric of their lives. So just like a month or 6 weeks ago, we sat there and there's a book about a kangaroo.
The kangaroo pouch or something. Yeah.
So we read them that book. And then I have 2 little books about their stories. I actually brought them to show you. My friend who carried my son, she made a little board book about his story. And then I made one for my daughter. So we read the kangaroo book. I read them their books. And I basically said, I was like, Mama had a boo-boo because I didn't know how to explain preeclampsia. So preeclampsia is my boo-boo. And so I needed my friend and this other woman to help bring you into the world. And, I'm like so emotional telling them, silent tears coming down.
And they're like, cool.
They're like, okay, Mama, let's go play. And I'm like, oh.
They're like, wow, cool. All right. I'll tell my friends. Thanks.
Yeah. Which is really how it should be. Like, I don't want it to be a big deal. But I want them to know.
Yeah. These kids are better equipped to handle the world than we are.
Yeah. And my son, my 5-year-old, I don't know. I think my daughter has retained it, but she hasn't really talked about it. But she sometimes, I feel like 6 months from now, she's going to say something about it. But my son has brought it up a couple of times and he understands. He was like, you had a boo-boo. You needed my friend to put her in my belly. And he's like, that's okay. And I told them I was coming here to tell the story about how they were born. And my son said, oh, you should bring the books that you have to show the doctor. So I think they're just like, okay, that's how it happened. And actually my son today said, well, what? He's like, don't a lot of people do this? Like to him, which I was so happy about. I'm like, good. He doesn't feel like this is, a stigma. I was like, well, a lot of people do it, but not everyone has babies this way. So I want to tell the stories in case it might help other mommies and daddies who, want to have their babies this way. So so they know, and I'm relieved. It was starting to feel stressful to me that they didn't know, because I don't, things that are secretive seem shameful and bad.
Yeah.
So, and this is a good thing.
It's just hard. At what age are they processing this? And and they'll probably to be revisited as they get older and, understand more and start to say, wait, huh? What? And they, start to think about it and biology and all that stuff. But that's, does day to day, when you're running around, you're working, you got 2 kids. Does this come up at all? Like, do you even think about it, or does it do you have to talk about it anytime, or is it just only if there's like a deliberate conversation like this?
I think it doesn't come up, but I do think about it. I think my husband doesn't think about it at all. I think, no, but also it didn't happen to him physically, the whole experience. So I think that my grief process with not being able to carry a baby is what I deal with the most still. Like I'm not over it, for lack of a better way of saying it. I think it was so traumatic for me. And, I've talked about it. I have therapy. I've done all the things. But I think I still feel very sad that I wasn't able to carry a pregnancy successfully. And so, I see pregnant women. I see patients who have just had babies. So it's in my mind. It doesn't come up out loud a lot. And, when I'm with my kids, they're my kids. Like, there's no bonding issue or worry that I'm not their mom or anything like that. And I think now that they know about it, that feels better too, because I don't want them to I don't know. I didn't want them to question who their parents were. So, but I think that grief is still there. And that's the other, again, like that. And that grief feels very lonely now because no one else, I have 2, and I'm so grateful and I'm so happy and my kids are wonderful. And, I wouldn't want it any other way, but I still feel sad about what happened. I think it's like any loss or grief, it never goes away completely.
Yeah.
And, certain things trigger it, and, it's still, I've, of course, have gone to baby showers and had pregnant friends and all this over the years. And I still, when I still hear those things, I still have little twinges, I couldn't do that. Why couldn't I do that? And I think some of it is also, my own perfectionist. It does, because in a way it doesn't matter. I have my kids, the process, shouldn't matter, but it still matters to me a little. And that's just being honest about it. Yeah. And I think that's important for people out there to know who have struggled with infertility and loss. I think it's okay to continue to have feelings about it because it's such a hard thing. And,
Yeah, I mean, that's a theme that's come up a lot on this podcast where, you can simultaneously feel very blessed and grateful and have tremendous loss over bad things that happened. And they're not exclusive. They're not mutually exclusive because it's true. It's no different if someone lost a parent, you're grateful you have your other parent, but doesn't mean you're not sad you lost your parent. Like, of course, like people grasp that in so many other aspects of life. But for some reason with, fertility and having children, there's this thought that, okay, you ultimately have your baby or your babies or your family. So all's good. But no, all's not good. Horrible things happen to you and beautiful things happen to you. And you have to walk through life with both of those. And you will. Are there certain dates that trigger, the date you delivered or the date you were due? Those are frequently things, or Mother's Day, things come up sort of on the calendar.
It's the delivery dates. So the two major pregnancies. I mean, obviously I've had 5 pregnancies, but the 2 preeclampsia pregnancies.
So those birthdays, I guess.
And nobody remembers. I mean, only my husband, and barely, he tries to remember because he knows it affects me.
Yeah.
And he's honest about it. For him, I think he was, of course, so sad. And he's sad that I still feel loss, and feel sad about what happened. But I think for the partner in these scenarios, it is once you've gotten to the happy ending, I think it's easier for them, or they don't think about as much about what happened. But those days are still hard for me. They're not as hard for me as they were, initially. And, some of the other thing that's, we all have memories through our life, but there are some of those moments from those pregnancy losses that I can see. It's like a movie reel in my brain where I remember walking to the subway that day, coming up to the hospital. It's like it just happened. There's certain moments that are just so, so strong in my mind, the visual images of it. And those, they pop into my head. I think about it. And I think it's just part of it. I think it's like processing trauma, honestly.
It is.
And so
it's exactly processing trauma.
It is. But I am overall, I am so grateful. And even, and I think, I'm a slightly older parent, although by New York City standards, not necessarily.
Slightly
older, 47. I think in some ways that makes it easier to be a parent because you have you're a little more, relaxed about things. But I'm grateful. I mean, I have 2 healthy kids, and the fact that I got 1 healthy kid was a miracle after all the things I went through. And, we pushed ahead and went for a second. And so I'm grateful. I mean, they're healthy, they're adorable, they're funny. It's
great. I know you sort of sprinkled it in throughout the podcast, but has this experience sort of changed your interactions either with friends and family or you as a doctor with your patients? Because there's both. There's sort of the social aspect of this, but obviously there's a medical aspect to it as well.
I mean, I think I take care of adults, obviously, but I have a lot of female patients who are of reproductive age. So I have a lot of patients who deal with infertility. So I think I would have always been empathetic, but I think I have extra empathy. But I have to remember, there have been times where I've wanted to share. Some of my patients do know what happened that were around at the time, my longtime patients. Other patients, sometimes I do have this urge, I know how you feel. And but I have to, be professional and so it's a fine line. And I get very nervous, I will admit, when I see, pregnant patients in their 2nd and 3rd trimester, and I go in to read their blood pressure, and I'm like, please let their blood pressure be normal. Please let their blood pressure be normal. But actually, this past year, I saw someone who happened to be coming in for a checkup. She was 23 weeks pregnant, and her blood pressure was through the roof. She ended up having a healthy baby, but it was scary for me.
Yeah.
I'm human,
Yeah, it's triggering.
So, and I was just calling her OB. I'm like, gotta see her. I can't handle this.
Yeah.
But so I think in that sense, it does bring up a lot of feelings for me when I'm dealing with pregnancy or pregnancy related issues. But I think I also have a lot of empathy for it, or more empathy than I would have. And I also have more knowledge than I think as an internist, I have more knowledge than average about infertility.
Yeah.
And pregnancy loss and complications because of what I went through.
And probably
myself.
preeclampsia. Yeah.
Yeah. I wish there was more expert stuff on preeclampsia. It's such a crazy disease.
It is an absolutely crazy disease.
I don't know if your listeners know this, but back in the day it was called toxemia, right?
Back in the day.
I actually think in some ways it's a better term because that's what it feels like physically. That's what it feels like. You feel like you're being poisoned. I think that's where the name originated.
Yeah, no, it originated because it's basically your body saying this pregnancy is killing me, and if it stays inside, it's good. Yeah. And it's a toxic pregnancy. Really I think they took it out because for most people, they will deliver a healthy baby and they didn't want to say like, this is, I don't know. I have no idea actually why they renamed it, but yes, it's not, it was not incorrectly named. It was just maybe they wanted to soften it. Yeah.
Understandable.
Yeah.
But I do feel like we beat preeclampsia. I feel like we won. And, for your listeners, it is, and as an internist, I worry about patients who have had preeclampsia, including myself, because there are increased risks of high blood pressure down the line and heart disease.
Yeah.
So that is something that I monitor in myself, and my blood pressure has been good. But, I worry that I'm going to have cardiac complications from this down the road. Although I think in some ways, because my preeclampsia was so early, at both times, I didn't have it like swimming around in me for too long.
Yeah, it's also there's also two theories of whether, and they're probably both true, whether the preeclampsia actually changes your like physiology, your blood vessels, and there is some data to support that. Yeah. But it's also probably there's something that people who get preeclampsia may have some susceptibility, whatever that is genetic, I don't know, and that we haven't exactly worked out.
Yeah.
But so people have preeclampsia and pregnancy for one of those two reasons, or both have a risk of hypertension. Same thing with diabetes and pregnancy.
Right.
That's more the latter. We don't think that diabetes actually changes someone's metabolism. It's probably just a risk factor. Yeah, something about it. Yeah. So we think, but who the hell knows?
Well, I found in my opinion, and I don't know if there's any data to support this, so don't quote me on this, but I have found that a lot of my...
I won't quote you, but you're recorded. So everyone else might.
This is not evidence-based. This is anecdotal. Yeah. I found that a lot of patients who have white coat hypertension with me are very commonly get preeclampsia.
Yes. No, I absolutely. I think there's something, I agree.
Yeah. Okay. Yeah. So then there you go.
Yeah. No, for our listeners, white coat hypertension is one of the funniest names things. It's where your blood pressure is high, like in a doctor's office, but it's normal at home. And the thought is you come to the doctor's office and we freak you out a little bit and everyone's a little nervous. They go to the doctor and your blood pressure is a little bit high. And it's called white coats because many of us, I don't wear a white. Yeah, I don't wear a white coat. For me, it should be called, gray scrub hypertension. But yes, I think that there's probably something to it that their blood vessels are more reactive or something. Because most people, if they're anxious and you check their blood pressure, it's not high. Right. So who knows? It is interesting. Yeah. Look at that. We sort of shifted into medicine here.
Yeah.
Wow. Amazing. Thank you so much for coming in and telling your story. I do think it's really important for people to hear it and to know, like you said, this does happen to people. For those who are listening to whom it happened, you are not alone. Others, unfortunately, have gone through this. Also, for the majority of people listening who have never gone through this and will never go through this, to understand that it does happen to people, and to sort of, if you hear stories about your friends and, they lost a pregnancy, like sometimes it's more than you think. And just to really, again, that extra empathy, and it's still going to be there years and years and years later. It doesn't go away. And sometimes for people telling it, it's nice. It's memorialized. Your kids can hear this, as long as this podcast lives on Apple, they'll be able to hear it or wherever they'll be dropping. Spotify. Yeah. Cool. But thank you. I really do appreciate it.
Thank you for having me. And thank you for taking care of me.
It was a pleasure.
Thank you for listening to the Healthful Woman Podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.